I'm Matsuzaki, a psychiatrist. Today's topic is tantrums. It's not uncommon for children to throw tantrums, is it? I'm a psychiatrist, but most of the patients I see are adults. I don't treat children who throw tantrums as part of my clinical work. However, I do sometimes receive consultations from parents who are struggling with their child's tantrums. Even if you're not a psychiatrist, you've probably seen a child throwing a tantrum in a park or at the supermarket. This time, I've done a bit of my own learning about tantrums, and I'd like to share what I've found with you. So, what exactly is a tantrum? It's an intense emotional outburst in response to emotional distress, frustration, or unpleasant situation, often involving flailing arms and legs or loud screaming. Most tantrums tend to subside within 5 minutes, but even if they last only 5 minutes, and especially if they go on longer, they can be incredibly challenging and exhausting for the parents or teachers dealing with them. Tantrums tend to peak between the ages of 3 and 5. They usually decrease by the time a child reaches 12. Boys tend to have more tantrums than girls, and they also tend to show more behavioral issues. That said, girls can certainly throw tantrums too, and many parents struggle with that as well. When it comes to the causes of tantrums, there are two main factors: emotional sensitivity to stimuli and a lack of ability to regulate emotions and respond appropriately. In other words, how easily a child's emotions react to something unpleasant, and whether they're able to manage those emotions on their own. Parenting style also seems to play a role. For example, early weaning, such as stopping breastfeeding at an early stage, or trying to switch from milk to solid food too soon, has been suggested to weaken the emotional bond between mother and child, which may lead to greater emotional instability in the child. Another factor is overly strict toilet training, which can cause psychological stress for the child and may trigger tantrums. That's why getting frustrated and scolding them for not being potty trained quickly enough, or getting angry every time they wet themselves, is something best avoided.
So, does that mean we should just avoid all stress? Not exactly. Giving in to everything a child wants isn't the answer.
It's said that when parents overindulge their children, the child doesn't develop the ability to regulate their emotions, and tantrums tend to increase. Another key factor is how parents interact with their children. When a child's feelings are not respected, it can lead to more tantrums. Being overly strict can also increase the frequency of tantrums.
It's said that when parenting is one-sided,
where the parent gives orders and doesn't respect the child's opinions, children are more likely to throw tantrums. In that kind of environment, children don't get the chance to express their own thoughts, which makes it easier for frustration to build up
and eventually come out as tantrums.
When parents become overly controlling, children tend to develop feelings of anxiety and stress. So then, how should parents interact with their children? It's said that when parents respect their child's opinions and aim to build a more equal relationship, tantrums tend to decrease. In that kind of parenting, children are better able to express their own thoughts, making it less likely for frustration to build up. It's also said that when trust grows between parent and child, the child gains a greater sense of security and emotional stability.
So how should we respond to children who are prone to tantrums?
The first and most important principle is to stay calm. When a child is having a tantrum, it's crucial to remain calm. Yelling or trying to forcefully stop them, those kinds of reactions can actually make the tantrum worse.
Sometimes a child throws a tantrum to get something.
For example, they're having a tantrum because they want you to buy them a snack. When the tantrum is driven by a demand like that, it's best not to give in. In this case, it's better not to buy the snack. If a child learns that throwing a tantrum will get them a snack, the tantrums will continue. In some cases, the child may have already learned this pattern.
When that happens,
refusing to give in to tantrums over snacks will likely make the tantrums even more intense. However, the increase in tantrums from not buying the snack is only temporary. From the child's perspective, it's natural to think, if this tantrum doesn't work, I'll just throw an even bigger one. But even so, if you consistently refuse to give in to the demand, tantrums that are meant to get something will gradually decrease in the long run. However, like wanting to be held or wanting someone to listen,
If the tantrum is about seeking physical closeness, it may be okay to respond to it.
later, once the child has calmed down, it's important to talk with them about how they can ask for a hug or attention directly instead of throwing a tantrum. Tantrums often happen when a child is overwhelmed by emotions they can't fully process. To help the child learn to express uncomfortable feelings in ways other than tantrums, to show that you're willing to understand them, and to support the development of their ability to cope with
distressing situations, these are all important.
Understand your child's emotions.
When they're having a tantrum, show that you're willing to understand why they're upset.
Encourage emotional expression. Like, I'm sad or I'm angry. Help them learn to put their feelings into words. And teach them alternative behaviors. When they feel like they're about to have a tantrum, show them other ways to cope. For example, suggest things like drawing a picture or listening to their favorite music, activities that can help them shift their mood. What about medication for tantrums? In cases of attention deficit hyperactivity disorder, ADHD, medication used to treat ADHD may help reduce tantrums.
For children with autism spectrum disorder, ASD, antipsychotic medications such as risperidone can help reduce tantrums.
However, the goal of these medications is not to eliminate tantrums completely. Proper behavioral support is even more important. It's also important to be aware that each medication may come with potential side effects. And most importantly, medication is not always necessary when it comes to managing tantrums. So, did this help you understand tantrums a little better? I feel I've deepened my own understanding of tantrums through this. If this video is helpful for your parenting, I'd be very happy. And even if you're not raising a child yourself, please feel free to share it with any friends who might be struggling with parenting. That's all from me. Hey!